Sir, any take-home message for people from
Right.
your side, not just about fever investigation, but about I always like to put across as what I feel is that investigation would be probably a preventive measure.
Correct. Right. So I can break this down into two parts. Okay. One, when the patient is actually having an illness or a patient is symptomatic, wherein you need to speak to a practitioner, either your family physician or a consultant, or if you're looking at fever investigations, you can come down to the lab and speak to one of our doctors, and then investigate it further. So that becomes a diagnostic part of the fever investigations. However, there's a lot of emphasis which I have started putting in the last 5 to 7 years is on a preventive diagnostics kind of a thing. Now, the preventive diagnostics is more commonly covering your lifestyle illnesses, right? And also certain screening for cancers. We are looking at lipid profile. We are looking to screen for diabetes. So these things, okay, fever will come and go, right? But these things are all chronic things, and they are there to stay with you for a very long time. So what I usually suggest when a patient asks me is that you get your fever investigations done if you have fever. Okay, get rid of it. Okay, however, once you're fine, you look at the preventive aspect of it also. You look at preventive investigations. You look at health packages that are being offered, because those packages will screen you for chronic illnesses, and that is something which is going to do you more harm in the long run. Okay, there are cases, quite a few of them, where we have identified young individuals with a very high cholesterol, with hypertriglyceridemia, and they have been put on treatment. We have seen young individuals who have a very family strong history of diabetes, but they have never been investigated, so then we have diagnosed diabetes in them, right? And many middle-aged people, we when we are doing a health package, we usually screen for your PSA or CEA and all this kind of markers. So there are quite a few people where we have screened for tumor markers, and they have been found to be elevated, and when subsequently investigated, okay, they have found to be cancer, and thankfully cancer has been picked up in early stages, and they have been treated early. So that has given them a normal life and a long-term survival. So take-home message would be this: that first, if you are symptomatic, okay, see a practitioner and investigate. But if you're not symptomatic, okay, you go in for a preventive health checkup at least once a year, just to see everything is fine with you.